We are live and folks are joining us, and I'm excited about that because I've got a great friend here today, Dr. Tom Frieden, who was the former director of the CDC, and he has a new book, and it's called The Formula for Better Health. And that's not at one level, it's at two levels, both at the individual and the population level. So there's a lot to discuss here, Tom. Congratulations. I know the book was formally published yesterday. Is that right?
Absolutely. Thank you, Eric.
Yeah, no, it's really very thoughtful. And we're going to go through some of the really great points in it because you have nailed some of the issues that we are confronting to get us to a much healthier state, both as Americans or globally, and also as a personal health story. Now, one of the things that I thought was so perfect that you delved into was the Cassandra curse. This is kind of a cornerstone of the book, and you take it to, great extent. So maybe you can start with that about the Greek mythology, this curse, and how it all applies to getting us healthier.
Thanks so much, Eric. The Cassandra Curse, actually, the working title for the book, which I've worked on and off for 10 years, was How to Break Public Health's Cassandra Curse. And then I found out that most people hadn't heard of Cassandra. So that wasn't going to be a very effective book title. Cassandra was a priestess in Greek mythology, and she was blessed with foresight. She could foresee the future and future tragedies that were going to strike. But she was cursed that nobody believed her when she prophesied those future tragedies, and so they all came to pass. And that's been what we've been like in public health and actually as individuals also. And breaking the Cassandra curse is part of the formula. It is really an approach that's been proven that has saved millions, actually literally hundreds of millions of lives, and can save hundreds of millions more. And it's really relevant for individual health as well. And the approach, the formula is see, believe, create. 3 phases. And the Cassandra curse is really part of the see phase. We have to see the invisible threats that are coming at us that are going to kill us. We also have to see the toxins that we can't see in our environment that may be poisoning us.
Right.
And we also have to see the trends of, like Ebola. When I was running CDC, Ebola was exploding in West Africa. We couldn't get anyone to pay attention. And then a modeler, Martin Meltzer, showed this exponential increase, and then people got it. So you have to see trends. You have to see whether programs are succeeding or failing. And one thing I'm sure we'll talk about in a bit is you have to see the path to progress, the technically rigorous path. But you also have to see why we're blind, why we don't pay attention to those warnings. And the Cassandra curse really indicates that we may know something bad is going to happen, but we don't act on it, and why. And in chapter 2 of the book, I talk about 6 of the drivers for the Cassandra curse. And the underlying theme there is that our perceptions are wrong. Our perceptions are inaccurate. We think things about ourselves, about the world, and about the future that aren't really aligned with reality, and therefore we don't act. I'll give you just one of these 6 drivers of the Cassandra curse, which is a fancy term called hyperbolic discounting. And what it basically says is we shortchange the future. If every smoker knew that they had a 50-50 chance of dropping dead after the next cigarette, not a whole lot of people will keep smoking. But 50% of smokers, unless they quit, are going to get killed by tobacco. So how then do we break the Cassandra curse? And for each of the 6 drivers, I go through a way to break it. In terms of the shortchanging the future, the hyperbolic discounting, it's kind of cool. You can do 2 things. One, you can use emotion and rationality to think of something far in the future as tomorrow. And 2, you can reward yourself or society with short-term gains that compensate for that longer term. So to give you one example of each, in the time management field, if I get a request for something, go to a meeting, give a talk, I used to show up at these talks and think, why did I agree to this? And I realized, well, I agreed to it 6 or 12 months ago when it seemed like it was never going to happen. So now when I get an invitation, I say, if it were tomorrow, would I do it? And if
Yeah.
the answer is yes, then I do it, like this wonderful podcast. But often the answer is no. If it were tomorrow, I wouldn't want to do it, but I would have said yes if I hadn't asked myself that question. The same is true for health. If we can use our rational brains or use our emotions to think something as right here before us on a public policy, to give you an example of this, Philadelphia got a soda tax passed by including the revenue going for early childhood education. So you give a short-term benefit in addition to the long-term benefit. So a long answer to a short question.
Well, no, that's great. I mean, what I want to do is I want to show this graph to everybody. This figure 1.1. Okay, this graph, here we go. You see how that hockey stick takes off right there? No intervention or intervention. This is a famous from the book. You're in the situation room. You are now trying to convince, talk about a Cassandra curse, right? You're trying to convince it's 2014. Ebola is warming up, people are dying, and nothing is being done. It's being ignored. You can see it, you believe it, you want to create a plan. And you show this figure. Tell us about that experience.
Yeah. So it really felt like the Cassandra moment. We couldn't convince people to invest. We couldn't explain how bad it was. Um, I had gone to West Africa or was going, and in West Africa, I had to meet with folks and say, we're not going to get aid here in time. Cases are doubling every 3 weeks. And it was really the explanation that there could be 1 million cases within, by the end of the year. This was May, June, and by January, there would be 1 million cases. And what's interesting is that did galvanize action. And
Yeah.
Samantha Power talks about that in her book as well, this dramatic table drop in the Situation Room. But there's more to this modeler. Martin Meltzer had done something also very interesting. He had shown us the route to progress. He showed that if we got to at least 70% safe care and at least 70% safe burial, cases would drop just as rapidly. And
Mm.
so part of the C part of the equation, the formula, see, believe, create, is to see the technically rigorous path to progress. And um, some people criticized Martin's model because, you know, you probably would have changed if things had kept doubling every 3 weeks. But the point was, without change, that would have happened. But, I'm just going to show figure at 1.2,
Oh,
which
yeah.
is really interesting.
Right,
What
right.
this showed was he was exactly right. If you superimpose what happened on what he said would happen, that's exactly what happened. So I think part of technical rigor is seeing the pathway to progress. And that includes not just RCTs, randomized controlled trials, but it includes practice-based evidence. It includes practical experiences. And I think often, look, I'm by training a tuberculosis specialist. Randomized control studies started with tuberculosis, and we learned how to treat. So I think they're fantastic, but they're just one form of evidence, and they're
Oh, yeah.
not necessarily the best form of evidence for everything. Only for some things. So when we talk about seeing the pathway to progress, we also have, and this is very relevant for personal health, and I think we have to be really frank about almost certain, likely, possible, or just a guess.
Mhm.
And for a lot of things that are relevant for personal or societal health, you really have to think of which of those categories it fits into if you're going to see the pathway to progress and then figure out how to believe you can make more progress and systematically scale up.
Yes. Well, you show so many great examples, and you really hit hard on this scene. You have to see, you have to acknowledge the future, the invisibility feature. Like, for example, you go back to 1925 with putting lead in gasoline with Alice Hamilton, and how we went 50 years before not only were children having, mental development issues, adults with heart disease. I did discuss this with Bruce Lamphir in a prior
Yeah, I listened to that.
kidney stroke, all this stuff. And it took all that time for the Cassandra curse to be broken. It's amazing. And of course, you take us through the TB in New York City, the TB resistant in the early 1990s. So many great examples. And as you say, it's not just randomized trials and modeling, natural experiments. I mean, still so many people won't get a shingles vaccine. Um,
Oh.
and we see the data consistent, three big natural experiments in Wales, the US, and Australia that shows like 20 some percent reduction of Alzheimer's and dementia, which would be a phenomenal drug, but they don't see the benefit. I mean, this is part of our health problem. Is that true?
Yeah, I think there's, frankly, so much hype, so much sloppy thinking, and so much grifting in the personal wellness space
Yeah.
that the simple stuff gets lost. And part of the, see is hard enough. Believing things that may seem inevitable can be changed is also hard, but we've made a lot of progress. We can make phased further progress. We can cultivate optimism. But the hardest part of the formula is to create a healthier future because there are always going to be challenges. You have to prioritize. You have to organize. We deal with this a lot in our work at my organization, Resolve to Save Lives. We work in countries around the world, and people want to do everything for everyone, but you end up not doing the most important things for the people who can benefit the most. And this concept of progressive universalism, that we're going to start with the highest impact services for the people most in need, will benefit most, and then we're going to expand as resources, financial and human, allow, keeping it simple, communicating well, overcoming barriers. But I think this issue of getting past the hype in personal health advice, and one of the tools of technical rigor is understanding what I call burden times amenability. How big is the problem and how much can we do about it? So I would say shingles vaccine for dementia prevention, I discuss it in the book. There is some evidence. It may still be residual confounding or methodological problems, but the most recent study is really good because
Oh,
it's an
yeah.
experiment of nature.
Yes.
And we actually, this was the last reference. There are more than 500 references in the book. It was the last reference because it was just a preprint. And
Right.
so on the last day of the galley proofs, they changed the title and a couple other things. We got the reference right. But yeah, I think you have to look at what's a hype-free, and sure, there are things that are unproven that maybe you want to try because you want to do that. But let's be clear, blood pressure is probably the single most important thing that any non-smoker can do. If you smoke cigarettes, the most important thing you can do is to quit. But for blood pressure, the evidence is so strong that starting at 115 over 75, your risk of a heart attack, stroke, or death doubles with every 20-point increase. And since the SPRINT trial, great RCT, we've
Yes.
seen that down to 120 knocks down your risk of heart attack, stroke, or death by a quarter, 27%. So I think if and they're all great generic medications. Globally, countries treat hypertension for $5 a year with the best medicines there are. And statins, very, very effective. Physical activity, I know you're a big proponent. The
Mhm.
closest thing there is to a wonder drug.
Oh, yeah.
There's probably no pill or injection that can improve your health as much as regular physical activity.
Right. Well, one of the people questioned Stephen Thompson, I think his name. And by the way, if you have questions for Tom or us, don't hesitate to put it in the message. But he said, "Future for whom?" And you know, you we are, as I introduced, talking about your book that gets at both levels, the population and individual future. And as you mentioned, for the individual, not only smoking, blood pressure, low sodium, that blood pressure 120 over 80 still is not clinically accepted. That's still what, most primary care docs, cardiologists even will accept much higher blood pressures.
And they don't even hit 140.
You're right.
Eric,
Right.
we spend $4.5 trillion on healthcare in the US. The single most important thing we could get right is to control blood pressure even to 140.
Yeah.
And we don't do that even half the time.
No, and then of course the exercise. But that brings up this other concept that I wanted you to develop with us today, the prevention paradox. Uh, Tell us about how we are really the conflict between a personal benefit versus a population level benefit.
The prevention paradox is a really important concept. Jeffrey Rose came up with it. And the idea is that small changes across large populations make a bigger difference than big changes across small populations. And that can go in either direction, small benefits or small harms. I'll mention two. We talked about lead. Just a little bit of lead less throughout all of society creates massive benefits: economic, educational, cardiovascular, kidney. But no one person may know that they've been benefited. However, the industry that had to get the lead out may lobby and block those changes. Similarly, um, decreasing potassium or increasing potassium or decreasing sodium. If we just do that a little bit across all of society, no one's going to notice, but it may prevent thousands or hundreds of thousands of heart attacks and strokes, but the companies that have to change are going to oppose. So this prevention paradox is really important for two reasons. One, it's an example of why we don't see reality so effectively, so accurately. We don't see what's really driving health because we can't see the things that are making a big difference because they're making a little difference for a lot of people. But that has a political corollary, which means basically you're going to have tobacco, lead, food, alcohol, the polluting industries, a very concentrated and powerful opposition to benefits that will be for everyone diffusely. So public health has the odds stacked against it. We're always going to have to fight uphill. We're always going to have to say, listen, this is good for everyone a little bit and bad for a few groups a lot. And we're going to have to mitigate those few groups and organize the people who benefit from it. Because the prevention paradox is a very important concept. The things that will improve health most, we may never see.
Right. Well, and it also applies at the physician side because physicians will say, well, I don't see this in my practice, but their practice may be, a couple of thousand patients. And it's been proven, through other means. And so the same prevention treatment paradox is you just don't have a feel for the bigger picture, the bigger denominator. Now, one of the things I want to get to, because, this see, believe, create formula is what we have the antithesis of that right now.
Mm.
We're not seeing anything. We're denying everything. And then we can't even get to the belief or create a plan or, try to do something about it if you don't even get to the first part of the formula. So what, what are you seeing about the mess that we're in right now? What comments do you have about that?
Well, it's absolutely the case that the one of the biggest risks here is that we are undermining our ability to see the health threats to our lives, our livelihoods, our families. Take one example from many. Apparently, because of budget cuts and staffing cuts and the devastation of the CDC, public health is under assault right now. Literal assault as a gunman opened fire and fired close to 500 rounds into the CDC campus, but also figuratively with massive budget cuts, thousands of staff laid off, half of the national centers closed. And um, FoodNet, PulseNet, one of the things that tracks foodborne illnesses, is going to stop tracking Listeria and Campylobacter. These are two serious infections. They're spread, by the way, by raw milk, among other things. And if CDC isn't able, now we have government shutdown, if CDC isn't able to track things, you go to the supermarket and pick up whatever it is, a package of frozen peas or a TV dinner or something else. It may have bacteria in it that make you sick. So we
Yeah.
are undermining our protections. We are leaving ourselves blind to the microbial and toxic threats. We're also turning back the clock on protections against PM 2.5 that already kills 100,000 Americans every year, against mercury and arsenic and PFAS and other forever chemicals, which astonishingly, to me, contaminate half of the water in America. And they've rolled back the protections there. So what you have here is kind of that those concentrated costs, those companies that don't want to do things that will benefit everyone, they're in control now.
Yeah.
And basically, it's open season on your lungs because they
Mm.
can pollute all they want into your lungs. And this is the opposite of the prevention paradox. This is kind of the harm paradox, that basically you're allowing a few self-interested industries to pollute, to contaminate, to sell toxic things, and the harms will be very widespread. But there is a way forward. I think,
I
first
hope so,
off,
because it's looking pretty bleak right now, Tom.
it is, and I don't think we should be anything other but eyes wide open about this. But facts are stubborn things, and even if they're denied, suppressed, misused, misquoted, they're still facts. And they're still the reality out there. And people want to be healthy. When you look at the Make America Healthy MAHA movement, it's tapping into something very important, that people are so frustrated with our healthcare system where you can't get good care, with inappropriate overemphasis on some pharmaceutical treatments. I think that gets confused. Sometimes we overtreat some things and undertreat some things. But there are stubborn facts and committed people. And I think what we'll see increasingly is states, organizations, localities building forward, not building back, building forward to a health system, including both healthcare and public health, that's more connected, that communicates well, that prioritizes well, that creates alliances and resilience, that delivers results that matter to people, longer, healthier lives, that gets away from some of the really problematic conflicts of interest where we're paying way too much for medicines and vaccines and getting far too little of the basic care that can save lots of lives.
Yeah. Well, you touched on again the seeing part of our environmental toxins, not just air pollution. You mentioned the particulate matter 2.5, but also microplastics, nanoplastics. We know they are causing harm. You already have studies in blood vessels, the brain, and whatnot. Reproductive health as well, maybe accounting for part of that is issue. But instead of this movement to try to have a healthier America, we're going in the wrong direction. And of course, denying even climate change and its intersection with another pandemic is also, part of the story. So in so many ways, we're going backwards, and you have provided us, a way forward, which is sensible. It's pretty simple. That's what's good about it is, the knowledge to prevent. It's all about that. It's not about. It's about ignoring or denying. I mean, what we have with this Cassandra's curse is a lot of denialism, and this is really unfortunate. I like your optimism about where we can head, but I don't see any of it. Like, for example, yesterday was published an important paper about COVID in children and teens with a second infection. There was a doubling of long COVID with all lots of other symptoms and outcomes that were adverse. And here we are. The COVID vaccines are only for people over 65, and we still have.
Even that, I mean, Eric, even that, the Advisory Committee on Immunization Practices at the CDC was basically taken over by unscientific ideologues who don't have expertise in vaccine. And I oversaw that committee for 8 years. It used rigorous, fact based science, complete transparency, every presentation on the web. I think it could have communicated better, but one of the things it did is to change vaccination against COVID, even for people over the age of 65, to what's called shared clinical decision making. That's only used if we're at equipoise and there is no evidence that it helps.
Mhm.
That's nonsense. There's
Right.
a dramatic reduction in severe illness or death among people who get vaccinated and are over 65. So that's an abdication of the government responsibility. Again, I think simplicity is important. And what I hope people get from the book is not just a message of hope, though I know we need that in this time, and it is that because we've made a lot of progress and we can make a lot more. It's also a message of how to make more progress, seeing the invisible and making it apparent, believing we can make progress, including making phased progress. So step by step, you can build that confidence and cultivate optimism, and then creating a healthier future with prioritized, simple, well communicated initiatives, solutions that overcome the barriers that are always going to be there. There are always going to be self interested groups that block public health progress. But for hundreds of years, we've been making progress. And really, I mean, you know this so much better than I do, Eric. We have amazing tools today. We
Yes.
have the best diagnostics, the best medications, the best vaccines that humanity has ever had. I'm pretty impressed with some of the artificial intelligence tools of making our work better, faster, and we have such potential to live long, healthy lives, to prevent most of the heart attacks and strokes that happen today, to avoid the toxic exposures that we're bathed in our modern environment.
Yeah. Well, that's where it gets us to the last topic I wanted to run by you. When I talked to Susan Menares before she suddenly was no longer at CDC, she and I were in alignment about the P, CDC-P for prevention,
Mhm.
which, there hasn't been enough of that. And we're at a time right now where if you can see your future, as you know, there was a recent Nature paper actually from Germany, which predicts your future events and health for the next 20 years remarkably accurately. And not just the events, but when. And then added to that, as you just mentioned, Tom, there's all these diagnostics, like, for example, it could be a polygenic risk score, it could be your protein organ clocks, all these other layers of data. We can do this now. We can say who's at high risk, and we know the ways to prevent these diseases. It seems to me that it's a really exciting time in medicine, which is being missed because of this enhanced capability for prevention, which I know you're into that because it starts with seeing the future. What are your thoughts about taking prevention, primary prevention, never getting the disease in the first place, to a new level in the years ahead?
Well, I think there are probably a handful of things that we could do as society and a handful of things that we can do as individuals that would really bring our leading cause of death, heart attacks and strokes, down to much, much lower levels. Health taxes on tobacco, alcohol, sugary drinks, junk food. Tobacco regulation, including denicotinizing tobacco, which the FDA has the authority to do. Alcohol prevention, including strong warnings, reductions of alcohol density, and sales of alcohol hours and places of sale. Front of pack warning labels. Chile, the country of Chile, did this, and it's a hugely successful way of improving nutrition. Reducing sodium and promoting potassium enriched low sodium salts. Regulating PM 2.5, soot, having gun safety regulations. Gun violence is one of the major reasons Americans live shorter lives on average than Europeans. In medical care, change the way we pay so the healthcare system will make more money if they keep people healthy. Right now, the healthcare system makes more money if people get sick. And in public health, we need better data systems, faster action, closer alignment with realities, enough funding, and getting back to scientific independence.
I'm with you, but all the things you outlined were at the population level. And what we saw when that is being done, like, for example, vaccine mandates, as an example, there are many others, get people bristled that, oh, I don't want to do this. I don't want to have my junk food tax because I live on junk food. Who knows what the comeback could be? However, at the individual level, again, because your book gets into both levels,
Yes.
and at the individual level, there's so much. If people want to know the risk, and they zoom in on how they can prevent that condition, that is something that we didn't have that. It used to be the Cassandra curse was I don't want to know ApoE4 status because
Mm.
I don't want to know if I'm a high risk for Alzheimer's. Now we're at a time where we should be able to prevent Alzheimer's if we
Yeah.
go after this. In fact, as you know, there's a couple of trials that are going to be out soon in the weeks ahead that are testing a GLP-1 drug, Ozempic,
Yeah.
two big trials, Evoke and Evoke Plus against Alzheimer's. If that, these are people with mild Alzheimer's, they're not even preventing Alzheimer's in
Yeah.
the first place. If that hits, oh my gosh. But I think we share the prevention excitement, and
Well,
I want to get you nail you down on at the personal level, not
yeah,
the
that's what
top.
I want to get to also. Just one point about mandates. It's one thing to mandate individuals. It's another to regulate companies.
Hmm.
And, I think mandates on individuals should be awfully rare. I don't think we should have been mandating vaccination, for example, during COVID. But mandating or regulating companies so they don't hurt people,
Yeah,
that's not about taking away personal liberty. That's about increasing personal liberty. Okay, six. There's six things that I think really make a difference for personal health.
yeah,
Get your blood pressure under 120.
right.
Get your lipids healthy, and that's probably your LDL under 70 and your ApoB under 70.
Yeah,
Uh,
and soon it'll be
physical,
getting your LPA low too.
yeah, yep, yep. Once we figure out what to do with that,
You got a
um,
drug coming for that one. Yeah.
physical activity, the closest thing to a wonder drug, at least 4 days a week, at least 30 minutes per day of moderately brisk activity. It'll do more for your health than any pill. And it's just great for everything. It's great for mood. It's great for depression. It's great for diabetes. It's great for obesity. It's great for cancer. It's great for blood pressure, even if you don't lose 1 ounce of weight. Sleep, as you've emphasized in your Substack, Eric, at least 7 hours, 7 to 9 hours sleep. Easier said than done, but there are things that can be done. And thank you for pointing out the new class of sleep meds that some people may benefit from. Nutrition. Nutrition is really complicated, but there's some things that are really clear. More potassium, less sodium, more fiber, less processed meat, less sugar. You know, it gets really complicated past that, but those things from an epidemiologic, technical rigor standpoint, I'm really certain will make a really big difference. And then finally, the sixth is avoid toxins,
Yeah.
tobacco, alcohol, PM 2.5, and the new ones, the big three, nanoparticles, microplastics, and endocrine disruptors. We don't fully understand what harms they're creating and how much, but they are not good things to have in your environment.
Yeah, and they're tough to eradicate or diminish because you need health policy changes. You need there you go right back to the companies and the need for governmental regulation and enforcement. Anyway,
I'll tell you two little things I changed
yeah.
in my personal health regime after writing this book. I eat a lot more sweet potatoes because I had no idea they were so healthy and they're delicious. And I bought a reverse osmosis machine for my water because
Oh,
I
okay.
that's a way of avoiding plastics, microplastics, and 50% of our water has stuff in it.
Oh, no,
The,
it's a good idea. Having filters or whatever technique to reduce the microplastic exposure, it goes right into your formula. C. You can't see it, but you know it's in there. As you say, it's a big deal, and we can't ignore it anymore. Yeah, yeah.
Thank you, Eric, for what you do. You've been such a great voice of science. You are always at the cutting edge. You're always telling us what's around the corner, what's now, what's important. And I loved your book, Longevity, and I was fascinated by that you from a very basic science researcher standpoint, and I from an epidemiologic analyst standpoint, come up with pretty much the same formula for personal health.
Yeah, one of the questions was, what reverse osmosis machine did you get?
I've never taken money from a company, so I'm not gonna say what brand I use, but
Okay.
get onto Consumer Reports and Wirecutter and independent
All right.
assessments and see which have a good assessment.
All right. Well, the book is here, The Formula for Better Health. I think you
Oh,
have a good
and I
review
do
of
want to say that all proceeds from this book go to programs to support health around the world. They go to organizations and programs that resolve to save lives. The organization I lead work with, I don't get any of the profits of this.
Well, that's fantastic, especially when we've seen the USAID money taken, gutted and everything else, so foreign aid. So you're phenomenal, Tom. Thanks so much for joining today and all the work you're doing with Resolve, and keep up the great stuff. We'll be following it. That's for
Same,
sure.
same to you, Eric. Thank you so much. Great
Uh,
speaking with you.
and thanks everybody for joining today. Really
Thank you all.
terrific conversation and questions and messages. Thanks. Bye bye.